Our presentation is on Chapter 5 and 6. My name is Monique Barayan, and I will be talking about the population health model and the medical model.
My name is Cassandra Burr, and I'm going to be comparing the medical model and population health models and the influence of social determinants on health behaviors and health outcomes.
Hello, my name is Melissa Interiano, and I will be talking about the leading determinants of health, weighting the different domains in health policy and return investment.
My name is Nick, and I'm going to talk about public health in the 21st century.
Okay. First, I would like to discuss the population health model. It includes 5 determinants that are social and economic environment, the physical environment, genetics, medical care, and health-related behaviors. Can anyone give me examples of any of these 5 determinants?
Say it again.
Can anyone give me examples of any of these 5 determinants for the population health model?
Social and economic.
Physical.
No, but like what is in that umbrella of social and economic? Like housing, for physical environment, it's like waters.
Food deserts.
Income?
Yeah. Income is in like the social economic, there's genetics, there's the medical care, which focuses on treatment and stuff like that. Health-related behaviors, it's like includes smoking and exercise and diet. Okay. And then next is the medical model, which focuses on the factors that affect an individual's health, such as disease and illness. Okay. This image is from the textbook, and it shows that the United States is an outlier. We spend high amounts of money on healthcare spending. However, our life expectancy isn't as high as other countries. Okay. So the issue is that the United States is spending a lot of money on healthcare. However, we are not achieving a high life expectancy when compared to other countries. In 2017, the United States reported paying $3.5 trillion, 17.9% of GDP on health expenditures, and the United States ranked 26 out of 36 OECD countries in life expectancy and health. Okay, so what's causing these issues are high funding in prescription medicine. Last year, the U.S. spent $360 billion alone on prescription medicine, and the U.S. spends higher on drugs than other countries. The U.S. spending on pharmaceuticals exceeded $1,000 per person and was 30% higher than the 9 other developed countries. Drugs are harming patients and forcing them into hospitals. 1.3 million people went to the U.S. emergency rooms due to adverse drug effects in 2014, and 124,000 died from those events. And this is causing a lot of extra money that could have been prevented, because while we are helping them, we are sending them back to the hospitals to either get treated or get surgeries instead of just curing it altogether when they visit the hospital. And we are using band-aid solutions that do not fully cure patients, and this requires the use of many unnecessary tests and procedures that are expensive. David Nash, in one of the videos presented in the class lecture, stated that all experts agree there's $1 trillion wasted on tests that are dangerous, tests that don't do anything to our diagnostic armamentarium. So this road from volume to value is one of the key issues behind the need to understand population health. Okay. The first 2 bullet points discuss how alternative medicine has been linked to cardiovascular disease, and it's harming our patients. So I agree with the writers of the 3rd bullet point that stated the practice of integrative medicine should be based on distinct definitions, should be informed by evidence, and evolve from guidelines that are developed by experts from conventional and complementary medicines, so that we can use these methods of practice while keeping it safe for the patients. And then in individuals with low economic status, which is a health determinant, use more prescription drugs compared to individuals with high socioeconomic status. High age tends to increase the use of drug prescriptions, and the fifth bullet point mentions many diseases that we use prescription drugs for. However, many of these can be prevented by improving our public health. Okay, so my solution and goals are to reduce the spending in healthcare by lessening the prices and distribution of drugs, and to improve the health and life expectancy of the United States, and to diminish band-aid solutions by using alternative solutions such as alternative medicine and public health programs. This will reduce the amount of surgical procedures performed and reduce the number of drug prescriptions prescribed. As of now, we have a law that prohibits the government from interfering with negotiations with drug manufacturers. Therefore, I will need to have a discussion with the Congress in order to abolish this law so that we can lower the prices of prescription drugs for those that absolutely need prescription drugs and cannot get cured without it. Since drugs have harmed and killed individuals, the FDA shall include more regulations on drugs, and the FDA will need to begin regulating alternative medicine so that patients are using methods that are both effective and safe. As Dr. Paul Offit pointed out in his book, that we believe that alternative medicine is extremely helpful to the human body. However, because it is not regulated by the FDA, it is causing many people to get sick because they don't focus on how much they're consuming. For example, one thing that revolves around alternative medicine is to consume vitamin C. However, many people are consuming that in large amounts, so it's affecting their health instead of helping them. And then another way that we can help solve the solution is to promote value-based purchasing instead of volume-based purchasing. Does anybody know what value-based purchasing is?
No.
I think I know what it might be.
Okay.
So value-based purchasing would be on working on something that's going to improve your health as opposed to doling out large quantities of it with quantitative-based health. I don't know if that's right. Is that right?
Value-based purchasing is kind of like basically the healthcare is paying their medical staff based on the performance that they do. So basically, if you do a good job, then you get more money. And then volume-based purchasing, do any of you guys know what that is?
Volume? Oh, that's the number of patients they see, right?
Volume-based purchasing is based off of the amount of procedures that they do. So like the more surgeries that they do, the more money that they make. So yeah, so basically what this causes is for more doctors to basically want to do more procedures instead of actually curing them, because that's how they get more money. Okay. Another thing, well, methodology for Band-Aid solutions is to fund research in clinics that provide alternative medicine. It was mentioned in the film Escape Fire that a doctor was using alternative medicine to help with people that came back from the army that were injured. A lot of them were in a lot of pain, and instead of using prescription drugs, they ended up doing acupuncture on the back of their ear to relieve pain. So that reduced the amount of prescription drugs that they consumed. We also need to fund programs that improve public health. Also, what was involved in the film Escape Fire, Dr. Anish presented his program that gave different approach to treating heart disease. So instead of performing surgeries, we instead focused on what was causing all of these diseases so that we can fix the underlying cause instead of just fixing what was presented after the fact. So this involved changes in diet and lifestyle, and his methods completely avoided using prescription drugs, and he helped reduce preventable surgeries, which ended up helping lowering costs in healthcare. Okay. The FDA will need to hire more individuals to take on more tasks. Therefore, the Congress must be informed to make room in the budget for these additional salaries. And funding for programs like for alternative medicine and the research for it, and also the programs for the public health, will need to be funded from taxes in the government through Medicare and Medicaid. And when proposing my plans to companies, researchers, and the government, I will speak to them personally and use a presentation that allows them to view statistics and benefits that involves them. And when proposing my plan to people, I will use the media to spread information, which will be funded by private, federal, state, and nonprofit organizations. Okay, the way that my topic affects the Iron Triangle is that the quality of healthcare will increase by curing patients correctly and the public health and improving public health through programs, and the costs of the healthcare will decrease by lowering the cost of prescription drugs, reducing the number of drugs administered, and lessening the number of unnecessary procedures. And the access to the services will decrease specifically to people that live in the poor neighborhoods, because many of them will not be able to get involved in the public health programs. For example, people that live in poor communities are unable to purchase very healthy food, and like most of the time they are working often, which gives them less time to be able to exercise, which is a part of what Dr. Onisha's program involved. Okay, the conclusion, in order to cut the cost of healthcare in the United States while increasing its quality, we must stop administering band-aid solutions such as prescription drugs and avoidable surgeries, and start actually curing the patients using alternative methods, which are alternative medicine and public health programs. Individually, as a health administrator, this problem and solution is important because it is my job to maintain budgets and ensure that health services are running smoothly. Through a health organizational standpoint, the solution will be beneficial as it will reduce costs. And through the healthcare delivery system, this topic and solution affects the people involved in a positive way. For example, insurance companies will save on money, and as will the patients, by reducing the amount of surgeries. Okay, how much did the United States spend on prescription drugs in 2018?
Is it
300
C?
million.
Yeah. Okay.
360 billion?
Yeah. Okay, which of the following is not a health-related behavior?
Is it D?
D.
Yes. Okay. Now my
You're gonna hand it off to me.
yeah, I will be handing it off to Sandra.
Hello. Can you pull me forward? Thank you. That's her references. Hello. I know you can't see it, but I'm going to read you a little bit of the abstract. So the abstract focuses on the effect of disproportionate focus on the medical model versus the population model, benefits of using the population health perspective, how health determinants affect health outcomes, proposed solutions and measures for change, who will be affected, a theoretical budget, and conclusion. Thank you. So I kind of want to explain this briefly through a little visual scenario when I was reading about the population health model versus the medical model. So I kind of like using this as a description. Imagine looking through a keyhole and you see a woman inside a room and she's in trouble and there's rising water. And all you know is that she's in trouble and she needs to get out of there because she will drown. So the medical model would basically look at this scenario and say, this woman is in trouble, we need to get her out of there. But the population health model would look at, now using the population health model, you're able to see stuff that you wouldn't necessarily see if you were just using the medical model. So imagine the same scenario, but this time you can see through the door. You can see a lot more things that impact why the lady is in trouble. Like you notice that there was a leak and you can see where it's coming from. You see where it needs to be shut off. You also see that there is a looming live wire that's preventing her from wanting to open that door for fear of electrocution. So that's kind of a way I like to look at how population health model gives you these bits of information that have led up to this dangerous event, and by looking at those possible dangers, you can prevent the danger from possibly occurring. One second. Also, I wanted to talk about determinants of health and their effect on health outcomes. So determinants of health, as Monique had mentioned before, they come in different array. Some of them are physical, some of them are social, and some of them are economic. Like, I'm just going to give you a few examples. Like, one of them would be, like, let's say you're in an area and you don't have access to healthy groceries or food, or you're not able to find your way to a gym because it's not located on your part of town, or the transportation doesn't come there often enough, or you can't go work out at a park because you fear of getting stabbed or raped or murdered at night, or there's too much dubious activity that takes place after dark. So that's just a few examples of determinants that are going to affect people from being able to really working on taking the initiative to better themselves. Okay, we can go. So, I already mentioned determinants of health. In what ways do you think these might affect people from being able to make changes in their life?
Can you repeat the question?
When I was talking about determinants of health, what are ways you think that would prevent people from making lifestyle choices to better themselves? You're all fired. Come on, we all learned about determinants of health.
Money, I guess.
What?
Money.
That's a big one.
Access.
Access.
Ooh, also, our undocumented workers are unable to go because, like, immigration and all of that.
Oh, that's a good one. Okay, cool. Let's identify examples. So what has been seen? There's a few statistics. Right here is a giant, big old long little entry that I put from some research I pulled. I'm not going to read it to you, but basically it says that there's definite evidence that social determinants are one of the leading causes for health disparities that exist, and they're preventable. That's the saddest part. Okay, we can go forward. So, according to the World Health Organization, they see 3 critical components as needing to be addressed in order to actually reduce health disparities. And the 3 of them were: 1 was improve a person's daily living conditions, 2, face distribution inequalities, which I think is possibly maybe one of the hardest, if not the most significant, because that's something that somebody can definitely not do on their own. It requires health policy and probably a bunch of different intercollective of different agencies working together to help level the playing field, so to speak, because a person can definitely not address those on their own, and measure and synthesize problems and evaluate the actions taken. Okay. So I want to ask the class just one question. Do you think the health model holds, the population health model holds precedence over the medical model? No, this is just not even one of my questions.
Okay.
This is just like a food for thought.
Oh,
There's not a wrong or right answer, really. Was the point. Yeah. The point was mostly to get you guys to think. I'm not looking or fishing for a specific answer. The thing is, because we are talking about population health so much, I think people get confused and think that because it offers things that the medical model doesn't, that it's more significant. I think that it offers things that need to be addressed in order to properly fix the medical model, but I think they kind of work hand in hand. I think you do need the medical model, but you also need a way to prevent it if you can. If you can prevent problems from needing the necessity of medical treatment, then by all means you need to invest in that. But I think they kind of support one another, or if they were working as they should, they would support one another. A useful tool I think that supports what I said with the WHO is issuing health equity audits. So health equity audits are basically detailed surveillance of socioeconomic health disparities that affect people in health distributions, and they're necessary for checking your resources and implementing change because of the tools that they use I'm sorry, I need to do more research on that part. But I'll put it in there. But they are useful. Health equity audits. Look it up. Okay. Goals. Okay. Okay.
You're being recorded.
How do we escape quantity-based healthcare and heading towards value-based healthcare? Well, I think we should do this on a couple of things. Introduce quality-based health policy, reduce and punitively address poor health results in collection with quantitative-based care, encourage businesses to provide economic incentives to employees and maintain healthy lifestyles. Survey and inquire what concerns a priority population needs to address. Provide target populations with safe and affordable options for healthy lifestyle choices. Oh my god. Okay, so the methodology. Well, it's happening. Oh, okay. On the state level, I think we should stop monetarily rewarding doctors for expensive medical procedures. 2, stop rewarding physicians for health improvement and continue maintenance. 3, encourage businesses through tax benefits to develop programs that give discounts and reward employees who achieve and maintain healthy lifestyles. 3, enforce calorie counts in restaurants. 5, enforce and increase taxes for unhealthy foods, tobacco, and alcohol. On the local level, 1, offer rewards to problem surveillance in communities, train community members to read food labels and healthier decisions about meals and exercise. 3, have healthcare providers meet and work with community members to address these health problems in local committees. As subjects. So the subjects that we're going to, the subjects are going of who benefits is, I think everyone would be benefiting from this type of a change, providers and patients or recipients, however you want to label them. It's necessary to conduct things in a needs assessment, such as interviews, surveys, health screenings, focus groups, data analysis, observations, and prior cases. Projected figures. Okay. So to implement these changes, it's going to require a combination of state, federal, and local funds to finance an estimated budget of what I project as $250,000, $100,000, but I honestly think that's a little skimpy. With most of the funds coming from state and local for the particular area. How will the community be informed? They will be informed through health and, what are they called? Health educators that will visit these towns and that will conduct data analysis prior to visiting this town so they can identify priority populations. Okay, conclusion. Okay, I got there. Okay, what can we expect to see? We can expect to see a change in access and a change of quality with instituting these change. What remains unclear, there is stuff that remains unclear until it's actually enacted. And I want to ask, is healthcare acceptable as is? I would say no. Is the investment worth the risk? I would say absolutely. Okay, I got a couple questions. According to the WHO, what is necessary to address in order to reduce health disparities? A, crime. B, disproportionate inequities. C, government shutdowns. D, budget deficits.
Want a B?
B? Yeah. Yeah. Okay, question 2. A component of a proper needs assessment would include what? Random sampling, public solicitations, interviews, public hearings.
Isn't it? It's either between A or B. Am I right?
No.
Should I?
It's interviews?
Yeah.
Okay.
Oh yeah, that's
Bam!
right.
And I'm done. I'm going to be handing it off to
Melissa.
Melissa. Here we go.
Okay, hello everyone.
So as Cassie and Monique brought up some basic determinants of health, and I want to ask you guys, what are some leading determinants of health?
Leading determinants. Oh, okay. Where they live, like their zip code and all that. Do you mean like that type of stuff?
Yeah, like
Oh, okay.
like socio-economic factors, like you mentioned, like
Not access to parks after dark.
yeah, stuff like that. And my other question is, how can we create a society in which everyone has a chance to live a longer life?
How can we create a society?
Yeah, in which people can live a longer life.
Get people to adopt healthier lifestyles.
Yeah.
Yeah, but how? Okay, how is that gonna happen if there's a lot of people that live in the low income community that don't have access to stuff like that?
So give access to them.
Access to it. Okay, so to start off, health starts in our homes, schools, and communities, such as the range of personal, social, economic, and environmental factors that influence health status are known as determinant of health. So, an abstract. The issue is the determinants of health is impacting an individual's health status, and I will be talking about ways to prevent this from being a bad thing for those who don't have access or good quality to health care. So, what are the leading determinants of health? As I mentioned, one of them is social factors. So, some of the things that fall under the category of social factors are income and social status, which is higher income and social status are linked to better health. The greater the gap between the richest and poorest people, the greatest the difference in health. Another thing is education. Education is a big one because we could see that those who did not finish high school or did not finish middle school have a lesser lifespan, and they're not well educated on many of the aspects in the community, and it causes more stress and lower self-confidence. Another one is physical environment, which is safe water and clean air. That is very important in our community because there's a lot of people who don't have a good quality of air, or like they don't have good quality of water. And social support networks, greater support from families, friends, and communities is linked to better health. Genetics, like Monique said, inheritance plays a part in determining lifespan, healthiness, and the likelihood of developing certain illnesses. Health services, such as access and use of services that prevent and treat diseases, influence health. And gender, men and women suffer from different types of diseases at different age. So, susceptible to illness, injury, or long-term health problems, it is important to realize and keep in mind that one zip code is a tremendous impact to their health outcomes. So, how are social determinants linked to health outcomes? Certain subgroups of the population, particularly those who are less empowered and have lower socioeconomic status, tend to live and work in more degraded environments and have higher exposure to risk factors for disease, and as well as psychological impacts from chronic stress. Consequently, they have worse health and a shorter lifespan. So now I will continue on talking about other, like as I mentioned in the beginning, other leading determinants of health, such as physical determinants. As I mentioned, many people that live in the lower income community are exposed to toxic substances and natural environment, housing, homes, and neighborhood. Unhealthy behaviors such as smoking tend to be more prevalent among low income groups. Income or wealth enables one to afford a nutritious diet, to buy or rent healthy housing in a healthy neighborhood. By the same token, aspects of neighborhood environments such as the presence of sidewalks and playgrounds, after-school physical activities for children and youth, and availability of affordable, nutritious food. For example, proximity to supermarkets, which typically sell fresh produce, has been linked with less obesity, while proximity to small convenience stores, which generally do not sell fresh produce, has been linked with more obesity and smoking. People are more likely to be physically active when they live in neighborhoods with better resources for exercises, such as parks and walking or jogging trails with less litter, vandalism, and graffiti, and with street patterns and present fewer pedestrian obstacles. So yeah, a lot of like people that live in the lower income communities have lack of access, have poor air quality, and one of the solutions that we could bring to this is there's this organization called OHAMA, which is a community health organization that aims to encourage outdoor exercise, of importance of daily physical activity and outdoor group activities. So this could help those who don't have access to a gym, access to a park. Like this organization could help them become more active and prevent them from leading to a path of obesity, right? Okay, next we'll be talking about also health services. Lack of access or limited access to health services impacts health status of individuals, such as uninsured individuals don't have good quality care and delay medical treatment. Some barriers that prevent from the access of health services are high costs and insurance coverage, which leads to hospitalizations that could be prevented. Another leading determinant is individual behavior factors such as diet, cigarettes, alcohol, physical activity,
That with diet cigarettes. I'm sorry.
and according to Kovner in 1990, half of all deaths were due to tobacco use and diet, and 40% of deaths were due to behavioral factors. And how can determinants of health affect our lives? Well, an example is a 10-year-old African American boy who lives in the urban area, and he doesn't have access to playgrounds or parks. So that means that he doesn't have daily physical activities. That means he's at home watching TV all day, and things like this is what causes people to have a lower lifespan. Health policy and returns on investment. Investments and policy decisions should be made in low-income areas where they are not provided province of healthcare. According to Kovner, an investment of $10 per person per year and improving community-based programs to increase physical activity, improve nutrition, and prevent smoking and other tobacco use could save the country more than $16 billion annually within 5 years. So two-thirds in the U.S. is spent on preventable disease, and 5% spent on prevention of the disease, and 95% is spent on the medical care. So the goals and solution is for a better lifespan for those, well, actually for everyone, including those who live in the low-income community, is eliminate unhealthy foods in schools such as from pre-K to 12th grade, and provide high-quality early development service and support for all children. Eliminate cost of waste in healthcare spending so the money can be used on population, which will help improvements in education and public health service systems and environment. So, who are the people that benefit from these changes? Well, as I mentioned, it will be doctors, those who live in low-income communities, and everybody. So a methodology for those whose determinants impact their health status is by taking actions such as health equity should become a priority in healthcare, uh, such as training doctors, nurses, and other workers, and reducing unhealthy behaviors requires creating supportive environments that make healthy choices and easy choices, and asking patients about social challenges outside of the healthcare system in a nice way, and referring patients and helping them access benefits and support services, and primary care for people with disabilities. To make an impact on improving health equity and providing more patient-centered care, it is necessary to better understand and address the underlying causes of poor health, yet physicians often feel helpless and frustrated when faced with complex and intertwined health and social challenges of their patients. Many avoid asking about social issues, preferring to focus on medical treatment and lifestyle counseling. So once a social diagnosis has been made, social prescribing involves connecting patients with various support resources within and beyond the health system, such as local women groups, housing advocacy organizations, or employment agencies. So, you're still behind. I'm sorry about that. So, right here I'm gonna introduce a chart which explains some of the issues that's going on in the community within the healthcare systems, and on the side provides recommendations that doctors could do in order to improve the healthcare system, quality and access and cost for those who cannot afford it. And I'm going to talk about the iron triangle, how this connects to the iron triangle. The quality of healthcare will increase by improving development programs and public health programs. Cost, it will decrease so it can be affordable for those who cannot afford their medical treatment. And access will decrease for those whose determinants affect their health status. And conclusion. Determinants of health contribute to the overall health of each individual in the United States, including disparities in health. There are plenty of steps, improvements we can make in our community to allow everyone to have the opportunity to have a longer lifespan. Creating much more healthier and safer communities for all can only be accomplished through working together and providing services for all. Although addressing the social determinants of health requires a broad range of actions that involve collaboration in multiple sectors, example, education, justice, and employment, and local, provincial, and federal levels of government, physicians and other allied healthcare workers at the front lines of clinical care are nonetheless important players and potential catalysts of change. They are well positioned to support their patients in dealing with their social challenges, raise awareness of the human cost suffering that results from poverty, discrimination, violence, and social exclusion, and advocate for better living conditions to reduce health inequities and for more responsive health and social systems to care for those in need. So, my question: an individual income would be classified as which type of determinant of health?
A. Social and economic environment.
Correct. Okay, and my last question. The fact that an individual smokes would be classified as which type of determinant of health?
D. Health-related behavior.
Correct. And I conclude with this topic, and I will be transferring the time to
Nicholas.
All right. So my topic's more on public health in the 21st century, and yeah. So when we think of public health, we think of who's in charge of public health, and we tend to think more of the federal government than national government. However, there are also responsibilities and laws that are sent to the state government and local government. That's why some states will have some regulations that others are not in charge of. For example, Planned Parenthood could be one of those examples. Some states have abortion laws and everything like that. So depending on what state you're in and what local government you're in, the laws and regulations are different. The state government. The 10th Amendment of the Constitution says that the state is allowed to make rules aside from the federal government. Some of these rules and regulations or laws include stuff like use of marijuana.
How do I change it?
No, it was going off.
Oh, okay.
Some examples of this law in the Constitution could be like the use of medical marijuana, where federally it's illegal, but like here in California, we have medical use and recreational use. Speed limits, different states have different speed limits. So depending on if it's a school zone, highways, all the speed limits are different. Okay, so who is affected? Sorry, I got it. Who is affected by these, by public health in general? Public health should be in the best interest of the people who are affected by it, like the common people. Most prevention efforts are in higher income communities. Efforts like treatments are more for lower income communities. So in the lower income communities, we tend to focus more on treating the sick as opposed to helping those who aren't sick stay from getting sick. Many people believe that public health and health in general is a God-given right, and it's something that everyone should have. It shouldn't be something that's earned. While I do also believe this, I believe that depending on the cost of public health, it shouldn't be as given as most people. So let's say, for example, a homeless person does have a right to have insurance and have a home. However, he shouldn't have the same insurance as someone who may be paying for it in a private way. The voting for public health laws usually are done through state governments. Although the federal government does set some rules and regulations, it's more of the state governments that set the rules and regulations and that we are able to vote on. So some examples of public health that we use in every day that you might not think about. It could be something as simple as brushing your teeth, where you don't think about what's in the toothpaste, what the FDA regulates and everything. The health rating on restaurants, I know that's something that we see every day, where we see a letter grade on the restaurants, A, B, C's.
I've seen a B and I've still eaten there.
I've seen the B also.
Shouldn't have done that. That was gross.
See, I've seen the B on a place where I've eaten before, but I've gone there a lot beforehand, so
Okay.
I was used to it. Even putting on a seatbelt while driving, even though we think it's something that's normal, we think of something like, yeah, of course, who wouldn't put a seatbelt on? It wasn't always required beforehand, and now with regulations and everything, it's required. Like I said before, speed limits while driving, and even public transportations, like taking the bus, the metro. These are all still examples of public health. So does anyone know any examples of prevention when we talk about public health?
Prevention?
Yeah, there's 3 types of prevention. Do you guys know what
Oh,
they are?
primary.
Secondary, and
Tertiary.
Yeah, tertiary. I think it's
that's
tertiary, yeah. So primary prevention is what we use before someone is sick or before they're diagnosed with the illness. So examples of these are like screenings where, like let's say a breast cancer screening, you're kind of checking to see if there's anything there.
Secondary.
Wait, isn't the primary like basically like helmets when you're riding a bike and stuff like that?
Yeah, well, it's like
Instituting a healthy eating food program before you have diabetes.
Yeah.
so it's
So
kind of
it's
like
before you have the illness.
you're implementing a program or doing
we're doing
something
something.
before you're actually diagnosed.
Yeah.
I mean, no, I guess screening could be because you could be diagnosed already.
It can be either. I
Yeah.
think it can be primary.
Okay, how about this? So yeah, primary would be like wearing a helmet when you're riding a bike.
Yeah.
Although you haven't had an accident yet, you're doing something that could prevent a serious injury while having an accident. Secondary could be something where it's like an eating program when you're diagnosed with diabetes. So when you're diagnosed with diabetes, basically you have to watch your eating habits. So that's more or less, I guess you could say,
Yeah, because then you prevent like
you prevent it from getting worse.
yeah,
So
and prevent any other health conditions that could follow,
yeah, so basically you're
like
kind
heart
of
attacks.
for secondary, you're trying to limit the seriousness
Of
of
what's
your
already
illness,
going
your
on.
disease, yeah,
So
everything.
somebody told you your cholesterol is high, so we're putting you on this diet now.
basically, yeah.
Oh yeah,
Go. Okay, yeah,
Right.
time.
Yeah, tertiary prevention. That's kind of like in the more extreme. That's like chemotherapy during cancer because it's something that. How would I say this?
Like your illness is already at the extreme, so now you're just taking precautions.
Yeah, like your illness is already at the most extreme it is, so you have to take extreme measures basically.
Yeah.
So that would be an example of tertiary.
Oh, sorry.
Some goals for public health that could be implemented at like a state level or federal government level will be to start spending more money on prevention efforts. We spend too much money on treating the sick and the illness when we could be spending more money on preventing it and saving more money in return. Increasing life expectancy while controlling the population. I know overpopulation is a big problem in the U.S. However, we also want to increase the life expectancy of the United States because it's also one of the worst in some of like the most
Yes, in the
countries.
OECD.
And also to increase the general knowledge of public health. So, like I said before, some examples of public health we don't know they're actually public health. Something as simple as stop signs. So those are things that people don't recognize and realize. But once they are able to realize that these are public health examples, then they could probably study up on the topic more and research. And yeah. So.
Oh, okay.
Yeah.
Oh, weren't you gonna do questions, dude?
It was the primary and stuff like that.
Oh.
Did you guys know
So
all
all
of
of our
it?
topics cover how our health care in the United States needs to be improved, and ways that we can do this is by diminishing Band-Aid solutions when curing patients.
Or addressing health disparities. What the hell did it say? Let me look at the slide. Recognizing and addressing health determinants of something. There we go.
We could provide more services for those who don't have access to healthcare, and also the doctors could put their patients as their top priority rather than trying to attempt to cure the patient.
And also eliminating the cost of waste in healthcare spending. So the money could be used for population health and improvements in education and environment.
And this we conclude with our whole presentation. Hope you guys learned a little about our healthcare system and how population health model and medical model affect
An individual's health.
an individual's health and the determinants. Thank you.